Gentlemen, it's my pleasure now to welcome Sheridan and Belinda, physiotherapists from the Mater Mothers Hospital, who are here to help us learn a bit more about health and wellness during pregnancy. So welcome, Sheridan.
Hey. Oh, no, I've got this. It's good to be here, guys. And I guess I'm going to talk a little bit to start off with about some of the physical changes that we get through pregnancy. And it looks like some of you are already experiencing some of those physical changes and are well aware of them. But I guess the reason we get these physical changes can come down to two generalised reasons. One is the change in shape. So everyone's aware of that, the pregnant lady moves out this way. And that's a big collection of weight, I guess, around your middle, which changes your centre of gravity. The second change that we get in pregnancy, or it actually starts happening sooner, earlier in your pregnancy, is the hormonal changes. And so the hormonal changes are being produced primarily by the placenta. So right from early on in your pregnancy, when the placenta starts working, you're starting to get some of those hormonal changes, and they're great because they let your uterus muscle stretch from fist size to watermelon size. They let your skin stretch, they let your muscles stretch, but they also mean that you get a little bit of extra movement, perhaps in some areas you'd prefer not to, through your pregnancy, that is going to be really helpful when it comes to delivery, but maybe not quite so helpful earlier on in your pregnancy. So we're going to look at a couple of things you can do to help deal with those changes. And one of the first things we're going to look at is posture, on how your posture changes. So if you watch television, you'll realise that pregnant ladies walk around like this. Unfortunately, that's not true, or fortunately, that's not true. What tends to happen in pregnancy is that the posture faults that you have had through your whole life are just exaggerated by pregnancy. So that weight change and that hormonal change just tends to exaggerate those posture faults. So if you're someone that has had rounded shoulders, then you might find that in pregnancy you've got more rounded shoulders. If you're someone that's always had a big curl in their back and rests on your hips, then you'll be more like that when you're pregnant. So the main problem with that is that once you've had a few months of practicing that faulty posture, then you don't automatically go back to your pre-pregnant posture after you have your bub. So we want to make sure that we look after you while you're pregnant, but also you can look after yourself in anticipation for after you have your bub too. And of course, after you have your bub, you've got a whole new job that you have to be conditioned for. So, holding babies, nursing babies, feeding babies, all of those kind of things. So what we're going to do is just look at the different positions your body gets itself into. Now, we've got some fit balls, which are a nice way to feel what's going on in your back. So does anybody feel like they want to sit on a fit ball? And you don't have to be pregnant. So, in fact, sometimes dads are good at this kind of thing, because we know that up to 50% of dads do have some sympathetic signs of pregnancy-related symptoms. I know my husband certainly had the weight gain around the tummy. It took him till after the second baby to lose the tummy. So is anybody? Yeah, there's a lady up the back. Belinda will help you out. But I'm going to get everybody to participate. So some lucky ones get to have a try on the ball, but everyone can have a try just where you're sitting in your chair. So mums, dads, grandmas, aunties to be can all join in. So the first thing we're going to do is I'm going to get you to sit up nice and tall in your chair. So sitting up in your chair and sitting on your sit bones. So you might wiggle a little bit forward, but you know those bones that are hard in your bottom, or used to be hard in your bottom. So sit up on those sit bones. Good. And then I'm going to get you to rock back so that you're sitting on your tail a little bit more. And then back up onto your sit bones nice and tall. And then back onto your tail. Lovely work. We're all going as a crowd. It's like a little wave. So sitting up on your sit bones and then coming back down. And sometimes you can feel a bit of stiffness in your back. We'll do a couple more. See if we can get the crowd excited to come in to find out what we're doing. So up nice and tall and then back down. Great. And it's a nice way to feel a bit of movement through your back. But we know that when you're up on your sit bones, your spine's actually in a good position to be well supported. So the bones work more are designed to sit in that position, your muscles work more easily, and actually gives you a nice space for your baby to sit if you're pregnant. So that's a good position to be in to help prevent any aches and pains in your back. And these chairs actually aren't too bad. So if you wiggle your bottom back into the chair and sit up on your sit bones, you find it actually doesn't feel too bad. You'll probably make it through the next few minutes of our session without your back feeling too bad. Okay, the next thing we're going to look at is our upper back. So a lot of, I guess, modern society leads us to being in that chin forward, shoulders forward position, driving the car, being on the computer, being at work. So I'm going to get you all to do an exaggerated version of that. So chins out, shoulders forward. Great. We're probably not going to attract anyone in just now. And what I want you to do is to lift your shoulders up, roll them back over and down, and bringing yourself up nice and tall. Great. Okay, and back up onto your sit bone. So down onto your tailbone, rolling those shoulders forward, chin out. Lovely. And then we're going to correct it all. Shoulders up and over, back onto your sit bones and nice and tall. Can you feel the difference? What's your preference? They're up nice and tall. Good work. Okay, so I guess the other package, apart from getting ourselves into the right position, is getting our muscles to work the right way. And I guess a lot of you have heard of the core. And so if we think of the core where the baby is in the centre of the core, we might think of this big room as our core. So all these people are the baby. You wouldn't want to have that many babies. The walls of the core are your tummy muscles and also your spinal muscles. The ceiling of the core is your breathing muscles, your diaphragm, and then the bottom of the core is your pelvic floor muscles, or the floor of your core. So we know if all of those muscles, any builders in the audience, you know that you have to have a good floor, you have to have a good roof, and you have to have good walls to make a nice strong house for your baby. And so we want to get those core muscles working really nicely through pregnancy to give you some lovely support. It's like your body's natural corset or natural support system. We won't worry too much about your breathing muscles, except that you must keep breathing. But what I want you to do is perhaps start at the bottom of your core. So we know good foundations are the best way to go. So we think of your pelvic floor muscles, which are those muscles at the bottom of your core. And they say that pregnancy effects on your pelvic floor is a bit like a 100-kilo man sitting on a trampoline. Now, I don't know if you've seen a 100-kilo man sitting on a trampoline, but there's a bit of a dip. So we want to make sure that those hammock muscles that make that pelvic floor get some nice support. So everyone into their nice sitting up tall positions. We'll relax the pelvic floor first. And then just trying to tighten those pelvic floor muscles like you're trying to stop yourself from doing a wee. So squeeze and lift, and tightening those tummy muscles as well. And then letting it all relax. Good job. So pelvic floor in and up, and tightening the tummy in, holding it in for a few seconds, and then letting it go. So that's the number one exercise to be a support for you through your pregnancy, but also to help you recover after you have your baby. And it's also the basic building block of all other exercises we do. And at the Mater, we do run lots of great classes for pregnant mums and also postnatal mums. We've got the brochures there for our pregnancy exercises. We've got pregnancy exercises in the pool. We've also got classes, aerobic style and toning exercise classes, and we've also got Pilates, which are very small group, individualised programs. So we've got a lot on offer for pregnant ladies. We also got mum and baby exercise classes for after you have your bub, and as well as those aqua exercise and Pilates classes afterwards as well. So if you're interested in a group session, then they're a good avenue to go with. But we're just going to try one little exercise now, which is probably something that you're going to do a lot of times over the next little while or through the rest of your life. So I'm going to get everyone to sit down. Now, the people on the balls, I'm going to get you to keep your fingers on the ball. So we don't want any of those, grade 7 pranks where you stand up and the ball goes away. So you're not allowed to fall off, but everyone else doesn't really have to worry about that. So what I'm going to do is get you to start off in your slouch. So we're going to bring those shoulders over and out, up onto your sit bones, Engage that pelvic floor and tummy, and then stand yourselves up. Good, let everything relax. And then we'll go back down. So engaging that tummy and pelvic floor, bottom out and going back down. Good work, good work. Now, if you wanted to make it a harder, that's actually quite a good exercise. Do that 100 times and you'll probably be feeling a bit working in your legs. If you want to make it a little bit trickier, you could add some arm things in as well. So just have a go at trying to tighten that tummy and pelvic floor in, leaning forward, holding those muscles in, and then relax. Great job. Okay, let's sit back down, engage, and sit back down. So we won't go on to any more complicated exercises for your pelvic floor just now, but what we will do while we're talking about the pelvic floor and while I've got a captive audience, I'll just mention one more thing, and that's that as well as having a nice strong pelvic floor and a nice strong tummy, we also need those muscles to relax when we want to empty our bladder and empty our bowel. So being able to contract your pelvic floor is good. Being able to relax your pelvic floor is also really good. So the ideal way to do a poo or even to do a wee is to lean forward so that your body can relax, really let your pelvic floor relax and really let your tummy relax. So that relaxing is just as important as that contracting. So that was all I was going to share about exercise and keeping yourself healthy and well from a physical point of view through pregnancy. Does anybody have any questions along those lines? No? All good? Oh, yeah.
I used to do a lot, but
Mm-hmm.
I'm finding that it's getting quite sore underneath
Yep.
walking stuff.
So I guess if we're thinking about general exercise in pregnancy, walking's actually a great exercise. Perhaps now's the time to think about some pool exercise as a good alternative. So she was just saying she was getting some pain from walking. The other, sometimes in that tummy muscle helps to support, and so if you're feeling it there, it probably means that your tummy muscles are tired and they've had enough of, of what you're up to. So the pool's good because the pool supports you, so you can still exercise just as hard, but your tummy muscles are getting a little bit more support. They're not taking quite as much weight from your baby. I mean, the other alternative is some support there as well. So some of the pregnancy supports give you a little bit of a hold there so that when your muscles are tired, you can keep going. Yeah, but walking's excellent. Excellent pregnancy exercise, as are other kind of low impact type exercises in pool and exercises like Pilates, particularly if you've got a trained physiotherapist or someone with great qualifications, particularly in the pregnancy area, taking you through those exercises. So, time to hand over. Oh, sorry, quick.
Just regarding the walking,
Mm-hmm.
I had that same problem, and I go to hydrotherapy,
Yep.
swimming classes,
Yeah.
and I said to them, am I going to get a workout just as much as walking? And she was like, yeah, and I go, and I'm addicted now, and it's fantastic. So
So that was a great personal reference for water exercise.
I go twice a week, and it's so cheap.
I did not pay her anything. Thank you very much. Okay, we've got a couple of prizes for our helpers. Yeah, thanks, guys.
Now, my name's Shelley Wilkinson, and I'm the dietitian at the Mater Mothers Hospital. And I don't know who brought their binoculars, but our connection to the TV doesn't work, so you'll have to use your imagination when I've got a quiz to do. So as long as you listen hard, we've got some prizes as well to see who knows their nutrition for pregnancy and breastfeeding. Now, I'm talking about this because there's just been some new dietary guidelines released. We've developed some new programs at the Mater Mothers Hospital, and we've got some evidence-based resources. So we've tested them in research, and we found that it actually helps women eat better, gain weight in a healthier way. So I've come to tell you about them today. So I've got a quiz just to see how much you know about nutrition. So what is the most important nutrient or vitamin to take when you're pregnant, do you think? I've got a hand here. We've got folate. You win a prize. And there's actually two. Vitamin D is good, but it's not the essential one. Iron's important, but it's not the essential one. Is there anyone else that starts with I? We've got one. C's good, but that's not the... Iodine, fantastic. Yeah, so no one really knows about iodine. So folate we need to take in the first month before you become pregnant and the first 3 months of pregnancy. And iodine you need to take all through pregnancy because our soils are so bad. We usually get iodine from fruit and vegetables, but if our soils are bad, we don't get as much iodine as we need. So the government's actually said you have to take a supplement with 150 micrograms. So any of the good pregnancy supplements will have iodine in it and folate in it. Or you can get an iFol, so it just has iodine and folate. The other ones are good to get from a balanced diet, but you don't want to take them regularly. But those two are the ones you want to take regularly. Now, how much weight? Oh, this is a multi-choice. There's 3 answers. I'll get you to say which one you think is the right answer. So how much weight do you think you have to gain in pregnancy? Is it A, it doesn't matter, B, less than your friend, or C, it depends on what you weighed before pregnancy? We had a C here. Yeah, that's right. So depending on what you weigh before pregnancy, there's different amounts of weight to gain for the healthiest pregnancy possible. So get your peepers out, get your bionic eyes out. We've got a pregnancy weight tracker at the Mater that it's like the back of a stocking packet. What you have to do is you find out what shading you're meant to be in and stay in that for the rest of your pregnancy. And what we find is, because we're told our whole lives not to gain weight, and then we start gaining weight and we freak out. But there's actually gaining weight through pregnancy is a bit different from gaining weight after eating cake because we're growing a baby. So there's a healthy amount of weight to gain depending on what you weighed beforehand. So come along to the Mater. We've got this. Anyone who comes to our public classes gets it in a booklet, our public and private classes. But if you're coming through the antenatal clinic, you'll get that from your midwife at your first visit. And then the question is, do you still need to go for 2 and 5, 2 serves of fruit and 5 serves of vegetables when you're pregnant, do you think? Yes or no? Yes, that's right. It's not that you're eating for 2 when you're pregnant. You don't actually need to eat much more, but you need to eat twice as well. And so the nutrients that you get from your fruit and vegetables are iodine, you get vitamin C that helps you absorb your iron, and you get folate as well. Now, what is the most important vitamin to take for breastfeeding? Does anyone know that one? D is important, but it's not D. Calcium's important, but it's not calcium. Vitamin B is important, but it's not vitamin B. Does someone want to say iodine again? That's right, iodine. It's even, our requirements go up even higher than when we're pregnant. So when you're breastfeeding, you still need to keep taking a supplement that contains iodine. It could just be an iodine supplement itself, or it could be a multivitamin that contains iodine. And does anyone know what iodine does? Brain development. So that's very, very important. Now, the next question is, do you still need to go for 2 and 5 when you're breastfeeding? No, you need to go for 2 and 7. So that's the quality of your breast milk relates to the quality of your diet. So if you eat more fruits and vegetables, you get better quality breast milk. So does anyone know what a serve of fruit is equal to? Oh, wow, we've got an expert down the front, 150 grams. Wow, you've been on the new Dietary Guidelines website. So 150 grams is equal to a medium piece, so an apple, an orange, a banana, 2 small pieces like 2 apricots, 2 kiwis, or a cup of canned or diced or chopped fruit. Wow. What's a serve of vegetables equal to? 75 grams, that's right. 75 grams. So a cup of salad, half a cup of cooked veggies or like a good scoop, or a medium potato or a half a sweet potato. So generally and this is what a dietitian, generally snacking on green beans, carrots or cherry tomatoes is a great way to increase the vegetables in your day. Sometimes you can extend a meal by grating zucchini or carrot and hiding that for that's good practice for kids if you do it for yourself in pregnancy. And then I already answered the question, the quality of your diet influences the quality of your breast milk. So making sure you eat well when you're breastfeeding is important. Iodine supplement. And then every time you sit down for a feed, have a glass of water with you or a bottle of water and a little snack, and that'll keep your energy up because it's important to keep your energy. Often, what we say is it's like when you're on the plane. Often, the oxygen drops and you've got to look after yourself before you can look after everyone else. You didn't know where that one was going. So it's important to make sure that you keep sleeping well and well hydrated and eating well when you're breastfeeding to keep your energy up so you can look after everyone else in your life. So thanks very much for listening and answering the questions. We've got a couple of prizes that I'll grab to hand out to our expert down the front. And thank you very much. Are there any questions?